When you've spent over 10 years in psychiatry, you start questioning all of the constructs that have been taught to you, and you have been trained, and it's been hardwired into you. It's been drilled strongly into you to diagnose patients in those frameworks themselves. But sadly, one of the things that is grossly missing from psych training in most places in the world is that we have to be able to think outside of the box as well, because whatever it is that the established diagnostic entities are, they were established based not on some strong, robust scientific evidence. It has come through based on some consensus that we may have on some of the observations on some of the collections of signs and symptoms that we may refer to as a certain form of disorder. But equally, we haven't really looked at things in as much detail, because the brain's complexity eludes the logical minds cumulatively over years, and clearly we don't really have clear answers yet about what the right conceptualization of mental health diagnosis and mental health disorders would be. And hence I feel that we have failed our people in many ways and not being able to do it right. For example, when we say a construct, emotionally unstable personality disorder, that's such a half-baked, half-hearted, almost disrespectful construct when we say people who have fluctuations of mood and self-esteem and idealize and devalue constantly. Is that a good enough diagnosis for people to be helped out? I wouldn't agree with that, because first of all, to call somebody disordered in their personality based on what framework, as compared to what, and what are we referring to as disorder? The word disorder also comes from preconceived notions of what normalcy in a society looks like. So some neuronormal, neurotypical humans who are in majority genetically get together and decide this is what normal humans should look like. Is that the right thing by somebody who's A, suffering, B, we are just telling them, oh, all you've got is a disordered personality, we don't have a medication for it, all you have to do is to be in therapy. So we are antagonizing ourselves at so many levels. First, we're not helping them by saying you've got a disordered personality. If they asked us a question, what has caused that personality, we wouldn't be able to answer that properly, exhaustively, confidently, with a lot of certainty. No, we wouldn't be able to do that. If they said, well, if it's a disordered personality, you're convinced it's a disease, a disorder, then can you give me a medication? No, we do not have a medication for it. And if they said, what am I supposed to do? We'll say, well, you have to engage in therapy. Now, therapy essentially is to work upon oneself, is to be able to find out where do you stand in the coordinates of the world, who you are, how do you see the world, and where you can work in that interface. Now, if such is the premise, then is it not the lack of justice by the patient to tell them you've got a disordered personality, but well, it's not really a disease for which a medication can be prescribed. It's actually something in how you see the world, and that is faulty, and you could probably work on it using therapy. I think we are antagonizing ourselves at very many levels and aren't really doing the right thing by the patient, because a lot of the clients who actually get diagnosed with UPD sometimes end up being diagnosed with ADHD eventually, when there is an intent shown by a deep enough, nuanced enough psychiatrist, mental health professional to find out where their mood fluctuations actually stem from, where their fluctuations in self-esteem and the feelings of chronic emptiness stem from. Or they could actually be an undiagnosed autistic, or they could just be neuroatypical, or they just could be wired in a certain way, or would have had trauma of a certain nature, or would have felt constant oppression or constant trauma at the hands of society, that they have not been able to embrace their full authenticity. And that has ramifications, you see, emotional fluctuations and emptiness and constant thoughts about who you are and having lack of clarity around it, the identity crisis that is so characteristic of UPD, is likely to happen to somebody who has never really gotten a chance to come into their own, who have always had trauma and oppression at the hands of their significant others. And so to call it UPD is not a very helpful process, according to me.